Hi, I'm Mim Minicello, President of Hub International's Employee Benefits Practice here in New England. I'm so happy that you are with me today to have a conversation about one of the most damaging impacts of the COVID-19 pandemic, and that's the high level of stress in our workplace. Now, what we want to focus on today is the important role that employers play in this battle of the burnout. And as you listen, we'll leave you with real action steps that you can follow to truly support your employees during this difficult time. Now, I'm here with two teammates of mine from Hub International, true thought leaders in the health and performance space. Mary Lou McDonald from our Ottawa office, who is Chief of Health and Performance for Canada and a member of their senior leadership team for employee benefits. And Philip Swayze, who is the Chief of Health and Performance for the East region here in the U.S., both with long track records in this industry, but I'm going to give them a second to introduce themselves to you.
Thank you, Mim. My career actually started over 30 years ago as a sports scientist, before wellness was even a word, if you can believe it, eventually transferring my health and performance skills and learnings from the playing field to the workplace arena where the principal elements so closely parallel. I've been a workplace health researcher and educator, practitioner, consultant, and a senior executive leader in the healthcare safety industry and in workplace quality and excellence as well, with a particular interest in prevention. So I've long contributed to the evolution of this field where health and business intersect through much change and challenge over those 30 years. And just when I think I've seen it all, we have a global pandemic.
Hi, I'm honored to be here with you today and so grateful that we're addressing this topic. My father was a psychologist, and I have a bachelor's degree in psychology and spent the greater part of my 20s as a mental health counselor before moving into corporate America, while I have more than 20 years of experience in wellness program development and strategic consulting for both health plans and for large employers. Now, concurrent with my consulting work with Hub clients, I'm also a contributing think tank member for the Health Enhancement Research Organization, or HERO, where some of the mental health guidance that we'll discuss today comes from.
Now, for everyone in the U.S., May is Mental Health Month here. So this is a timely topic for us. And while in October is Mental Health Month in Canada, I think we'd all agree right now that every month ought to be Mental Health Month, as we see more and more evidence of the crippling stress and its impact on our employees. And let's talk data for a minute. The American Psychiatric Association had a study that said 1 in 5 people will experience a diagnosable mental health condition every year. 20%. And then another industry study showed in their survey that 56% of the respondents showed that stress and anxiety impacted their productivity, and 51% said that stress impacted their work relationships. Now that's all pre-pandemic. And I think we'd all agree that COVID has done nothing but exacerbate this condition or this situation for everyone. And while for me, employee benefits, the goal is often the management of costs, you can't help but recognize the cost of unmitigated mental health on our workplace. And confounding all of this is the idea that many of us think about mental health as a really, really private thing. And I know it is, but this is clearly a burgeoning employer issue. So Philip, can you take us to the drivers of mental health in the workplace?
Yeah, absolutely, ma'am. Listen, for years, mental health and well-being in the workplace have been a huge concern, right? Loneliness and social isolation that have been exacerbated by the COVID restrictions, those are serious risk factors that came to light a few years back. And we know from the Harvard study of adult development that social connections and relationships have a powerful influence on our health. Now, the data also tell us that depression is a comorbidity for most chronic illnesses, increasing the average cost by more than 250% compared to someone without depression. Now, none of this is new. In 2018, the World Health Organization had declared depression the #1 cause of disability. And as you can imagine, the scope of the health and well-being challenges, both mental and physical, are just too vast for us to fully address in the time that we have here today. But before we move on into the meat of our conversation, and in light of everything that's happened over the last 18 months, I want to point out that the National Academies of Medicine recently indicated that racial disparities were the #1 risk factor in the U.S. So it's critically important to acknowledge how COVID risks associated with social determinants of health have created this allostatic load, mostly on people who are brown, black, and Asian, or of low socioeconomic status. Now, this term allostatic load, if you're not familiar with it, is really the wear and tear on the body that accumulates as an individual is exposed to repeated or chronic stress. This weathering lowers life expectancy and negatively impacts the communities who experience it. In fact, the latest jobs report, which was overall very favorable, showed an unemployment rate for Black workers is still around 9.5%. Now, the other issue we need to address in the workplace is burnout and what individuals who are working from home day and night, as well as frontline workers who are spending their day in PPE. So I know that Mary Lou has some really good thoughts to share around burnout.
For sure. Thank you, Philip. I often hear that term burnout thrown around casually, but as someone who has suffered burnout, I can tell you it's neither benign nor temporary. Although feeling burned out is common, it's not normal. And the consequences, unfortunately, can extend beyond to your family, your relationships, your employees, and your career. The World Health Organization defines burnout as a state of vital exhaustion. In other words, complete physical and emotional exhaustion. And the pressure to address job burnout became so intense in 2019, they declared burnout an occupational phenomenon resulting from chronic workplace stress that has not been successfully managed. And this was before the pandemic. Now the situation is so much more broad and dire, and workplaces can no longer afford to ignore it, because when employees struggle, the organization struggles. In organizations, it cripples productivities and costs and manifests as low engagement, presenteeism, attraction, retention, things that are critically important to the success of organizations, and as well, obviously, an increased absenteeism and turnover. And something, though, we may not necessarily connect or associate with burnout is increased safety accidents and injuries and job errors or mistakes on the job. For individuals, it manifests over time in work performance and behavior. So you'll be easily frustrated or angry, cynical or critical about your work, unmotivated, disillusioned, and wanting to socially isolate from your coworkers and your family and friends. So, headaches, physical complaints, and one, may not be as easy to see working from home, but negative changes in our personal appearance. The chances are good your employees are dealing with these very same issues with or without your knowledge. And as leaders, you should be trained to actively watch for these signs, because they indicate long-lasting and significant health impacts such as depression, anxiety, substance use, and even suicide. As an individual, if you have very good self-awareness and agency, you may be able to notice these signs reflected in your own behavior. My personal experience tells me that's not typically the case. And even if you do, there can be a tendency, particularly with high performers, to override those little voices in your head and power through. An important point to make here, I think, is to not solely place the onus on the individual employee to do what it takes to feel better through self-care alone and bounce back. Rather, the environment, the system, or the culture in which we work has at least as much to do with creating and exacerbating the situation.
Oh, it's terrific point. So thanks so much for the definition in this environment. It's really helpful. And we could spend all day looking into the causes and the problems. I think you both agree. But let's go ahead and shift into problem solving. So for our audience, what are some of the best practices that employers can consider to more effectively address the challenges and improve resilience?
Yeah, no, let me start us off here. When we're talking about mental health, it can make people uncomfortable, right? And it's perhaps because we don't really understand it, or maybe because it hits a little too close to home. Perhaps it's both. Either way, I think it's important that we reshape the conversation and think about mental health challenges as existing on a continuum. So we often think of it as this binary fashion: either you have a mental illness or you don't. And due to the stigma that surrounds it, we'd like to all believe that it's not us, right? And it's some other people. And we can't influence their mental well-being. The truth is that about 69% of all people are in this stressed or moderate risk zone of a big bell curve, right? Think of this big bell curve. And at the low end over here, there's about 17% of us. We're feeling great. We're flourishing. And it's the 14% on this far end of the spectrum that are struggling and in need of an advanced intervention. And that's some of those individuals that Mary Lou talked about where they're really on the far ends and need some support. So listen, these challenges are complex and they can be confusing to understand, but the solutions and the path forward are really well documented and within reach for any employer who's invested in making a real difference. So I mentioned HERO at the beginning of my remarks, and there's several frameworks for addressing this issue. And I recently collaborated with a group of researchers and practitioners that we issued guidance on addressing mental health in the workplace. And this guidance was based on recommendations and studies from Europe and from Canada, places who are well ahead of the US when it comes to really effectively acknowledging and addressing mental health as a risk. So the first critical step is to address the stigma and normalize issues like depression and burnout and anxiety, and really acknowledge that at some point in time, it's really all of us who are struggling to feel our best self. This includes supervisors and the management team as well. And a successful leadership team really should be developing clear messaging and support a workplace culture that's actively managing any risk and creating resilience and supports employees' emotional well-being. And I just want to take a quick minute to say a Bounce Back Project is a great publicly available resource, and we'll share some other resources with the studio audience here. But this was created by a physician to address burnout and create resilience in your workplace using positive psychology.
That's right, Philip. In Canada, we also have several publicly available frameworks, but I'll highlight just one. In 2013, we developed the National Standard for Psychological Health and Safety in the Workplace, which is really modeled after the physical occupational health and safety standards we're most familiar with. This framework and implementation guide walks employers through the important areas to focus on, the right steps to take at the right time, if you will, to help create and sustain a mentally safe workplace and supportive workplace environment. As an employer, you don't have to guess at how to do this because sometimes it might feel overwhelming. These frameworks provide a roadmap for you and can definitely deliver the results you're looking for if you use them. For businesses in particular, the responsibility is very serious, especially now, because certain ways of managing people and organizing work can and does give rise to psychological injury. Courts and tribunals, certainly here in Canada, expect employers to be fair in their policies, procedures, and approach in dealing with employees who may be struggling with their mental health. And so our voluntary Canadian Psychological Safety Standard actually focuses on the very substantive risk factors that need to be considered, like workload management, psychological demands of the job, perceived control over your job, clear leadership and expectations, fairness, civility, respect, psychological protection from bullying, harassment, violence, and so on. So these root causes of employee burnout have existed all along in many workplaces. The pandemic has just amplified the need to address them. It can't be stressed enough, though, that the best cure for burnout is prevention. It has been well demonstrated that it's important to provide a psychologically safe work environment before any health promotion endeavors can succeed. And I can tell you, companies that were following a framework or already had an integrated wellness strategy in place before the pandemic fared far better than those that didn't. As lockdowns ease and we all start coming back to work, returning to the office, productivity will thrive in companies where employee well-being is a daily consideration. I know that for sure.
That's so important to talk through the frameworks and the guides, and thank you very much for taking us down that road. Let's move now to tactics and specific actions.
Yeah, ma'am, I'll kick us off here. We've mentioned some publicly available guidelines in both the U.S. and in Canada, and just a couple action steps that people can consider. We can't underscore enough the importance of addressing stigma and increasing awareness, right, by eliminating stigma and reducing some of those cultural barriers to accessing care. The other piece is consider mental health leadership training for people leaders. These trainings provide education that can also help leaders recognize when someone is struggling. An employee in need of mental health support can also look like an employee in need of a performance improvement plan. So trainings like these can help managers spot the difference between these. You should really look at the mental health resources that are in place today and determine what gaps might exist, right? So talk to your account team, your well-being consultant, and address them in a more meaningful way, right? So we know that U.S. insurers are reporting a huge shift in telemedicine, and that's great, right? We see that there's increases in behavioral health utilization, but unfortunately, it seems that for the most part, the spike isn't necessarily new people getting support, which is really needed. Rather, it's individuals who have already engaged in behavioral health support, simply shifting to the other channel. So we want to make sure that we're helping those other people feel comfortable about accessing those resources. So in terms of that, promote all those resources that you have. I've seen clients have huge success with increasing the level of promotion around it. Remove barriers to accessing things like EAP or the telemedicine or health coaching or digital counseling, right? I mean, classic barriers to consider are generally time, cost, and convenience.
Yeah, and I'd add as an employer, we need to recognize and separate well-being initiatives from mental health prevention strategies. That means recognizing and understanding that when someone's overworked and feeling undervalued, or systemic barriers for women in the labor force exist, or there's a lack of diversity inclusion, that those issues don't get solved by a meditation app or a lunch and learn. By this point in the pandemic, our boundaries between work and life have blurred well past recognition, and signs that we're burning out can be easily overlooked because we're working from home. So it's especially important to start to create a culture of openness that keeps employee well-being at the forefront and in the conversation. But often the hardest part as a leader, really, and I know this to be true, is knowing what to do about it. And at this point, it doesn't have to be a big, heavy lift if that's overwhelming for you. Rather, incremental changes can make a big difference. So despite the pressure for urgent responses, though, using assessments to understand the well-being needs of specific cohorts of your employee population is still the best way to go. But that said, some quick short-term actions to consider immediately could be things like do a quick pulse survey. If staff feel emotionally and physically exhausted, that's the first sign of burnout. Getting honest feedback is the first step to helping your team, so they know what they want and need. So ask them. Be flexible in this pandemic era. Learning to be flexible has helped many companies stay afloat with loyal workers. Negotiate with employees on collaboration efforts. Focus on overall goals instead of, that 40-hour work week. Vacations have plummeted. This is an important one. The number of hours employees spend away from work on vacation fell more than 20% last year to a nearly 40% low, according to Statistics Canada. So strongly encouraging time off and taking vacation is super important right now. No one should leave vacation days on the table, and employers should be proactively promoting that policy. Show your team how important this is, how to tackle work with a clear mind by taking much needed time off. Communicating clearly cannot be understated about your company's expectations about people staying connected all the time. I'm reading everywhere that this is a big pressure. Perhaps putting a footer on your emails as a leader stating you don't have an expectation that emails will be answered outside of your normal working hours. That'll relieve a lot of pressure for employees. I'd also say, based on my earlier comments on high performers and burnout, step up surveillance on those keeners that skip lunch or work late regularly. Check to see if this is a workload problem and then step in to correct it before it turns into burnout. Incremental changes can truly make a big difference. No meetings longer than 45 minutes, no meetings during lunch, no meetings on Fridays, something to consider, and encouraging employees to go on walking meetings. So walk during those meetings, listen to audio only. And of course, lead by example and show self-care in action. Leaders need self-care just as much as employees do. So demonstrate the importance of self-care and recharging yourself, which gives permission for others to do that as well.
So many amazing nuggets right there. Just fantastic stuff. Philip, will you take me now to how I recognize that I have a mental health problem in our organization?
Yeah, absolutely, Mim. You definitely want to look for the data. And when we think about data, what's interesting that I want to start with is that productivity has actually increased during the pandemic, especially work from home people, by an average of 3 hours a day of work, right? So boy, I'm going to take Mary Lou's advice and schedule a vacation. The question is, what cost is that extra productivity? So we need to make sure that you're watching your people. Now, as we think about sort of the more traditional data, we want to make sure that we're analyzing everything that we can. Look at monthly EAP reporting and see what those trends look like. Where are people accessing the work-life services? That can give you some ideas around where the struggles might be with financial well-being, or if it's some other element of mental health. Review your medical and pharmacy claims and look for trends. Look at your pharmacy data to see where people might be sort of overutilizing or overusing some of those drugs, especially in the U.S. And let's make sure to examine Family Medical Leave Act claims and short-term disability data. These can really be that canary in the coal mine to expose the downstream problems that perhaps you failed to proactively address.
Those are some great clues. And I see the important work of policy and structure that you've just taken us through to address mental health in the workplace. But let's move a little bit to recognizing the role as the manager as an individual. Let's pretend we're all people.
Yes. Well, in case it needs to be stated explicitly, managers and leaders are people too. Their world has been particularly upended during this pandemic, and really because the skill sets many of us needed or made us successful prior to the pandemic may not be the priority now, with the increased need and emphasis on resiliency, leading with empathy and compassion. It's a very stressful and emotional time for all of us. Morneau Chappelle actually compiles a monthly mental health index. And in the month of February 2021, just passed, in Canada, the scores of managers were actually worse than those for mental health scores for managers were actually worse than those of non-managers. And it's a situation they've rarely seen. But organizations are stepping up. In 2019, I'll give you an example. I worked with Canada Post to initiate a new program prioritizing mental health for its 70,000 employees and their families called Keep Wellness in Mind. And it's based on the principle that mental health and well-being of employees and their families is as important as their physical health and safety. With their CEO out front and leading the charge, among many other initiatives, they added mandatory mental health, that's a tough one, leadership training for all managers and people leaders, recognizing that they needed to have the confidence and the skills to not only recognize when someone's struggling, even themselves, but as important is to know what to do about it when you recognize it, and it really helps with the confidence. They also doubled down on their campaign to reduce stigma, provided new branding to increase awareness of the resources available to all employees. EAP got switched to EFAP, so to let everyone know that the families were involved. They expanded their program to include the 20,000 temporary employees and their families, and they established a mental health lecture series. I also recently became aware that the Royal Bank of Canada is working on an internal campaign to rebrand their mental health awareness among employees, and includes new messaging, which I think is pretty cool. We're all human and it can happen to anyone. And the bank's really emphasizing to managers that they can show vulnerability and still succeed in their career. And they're hoping this will cascade and permeate through their entire organization. So my final point on this is that everyone has the responsibility and the ability to strengthen their resilience to help cope with changes and demands in our work and our personal life. And if organizations add resiliency training to their toolkits for all employees, it'll make a huge difference.
I love that resiliency training for sure. And this is such a great set of information and guidance that you guys have put together here, which I very much appreciate. Could you both just give me a little bit more on what you're seeing as you consult with our clients in this area? Philip, can you start?
Yeah, absolutely. So I think that the most important thing, and we touched on this, amplify existing services that we know are historically underutilized, right? Traditional EAP in the US is like between 2 and 5% utilization. I have several clients who've seen double-digit increase in their EAP engagement because they focused messaging on mental health and they actively promoted the service from the leadership right on down through from the HR. The other thing is upgrade services that just aren't getting the job, right? There's been an explosion of vendors in this mental health space. And so our national team has taken a really deep dive into these vertical spaces and have been working closely with all of our forward-thinking clients who really want to better support employees at reducing risk and cost. So nationally, we've seen some clients moving from EAP to some of these fancier, full-blown digital mental health platforms like a Modern Health or Spring Health or Ginger.
Right, and we've had the same response here in Canada, actually, as well. In our employee benefits practice, we've made a strategic and timely pivot to focus on virtual health solutions about 6 months prior to the pandemic. So we were well positioned to support our clients, plan sponsors when the pandemic hit, and remote was the new norm. And telemedicine has been particularly important, not only for primary care, but for mental health, financial, lifestyle support as well. And we've seen the trend actually towards streamlining the suite of services traditionally delivered only by the bricks and mortar EAP providers, move on to the telemedicine platforms, which potentially offers efficiencies in access, but also the elimination of overlap or redundancies that plan sponsors may be paying for across several vendors currently. I often recommend if you can only afford one solution, then telehealth could be at the top of that list. It offers so many benefits for flexible and efficient access and cost, and it's great for both the employer and the employee. We've really leaned into this actually as an enduring solution for our clients.
Thank you. Wow, it's clear that workplace burnout is a serious issue impacting our companies every day. And it's clear to me, listening to you, that inaction is just simply not an option. The truth is, as an employer, the cost of doing nothing is prohibitive. So this is a terrific, actionable set of data. I'll come back and say, okay, what I hear from you is look at your data, build a plan, follow a framework that allows you to consider the mental health continuum that you've introduced. Prioritize your personal and your organizational resilience. It's real power in that word, resilience. And you can see from the team here we have at Hub that we've got the people ready for you. Let us help you get through this. In fact, join us for a live Q&A so you really can get on your path to corporate resiliency and just beat this burnout. Thanks very much for joining us.